We have another question today from Martha. She wants to know, do you have any advice for improving our chronic care management efforts?
Oh, great question, Martha. I've been a primary care physician for a long time, and I've started a lot of talks on this topic by saying, my name is Dr. Mingle, and I have care management envy. And what that means is, I've watched in my community. A lot of care management programs come and go for that matter. I once did an informal poll of all of the diabetes management programs that were in existence in our community, and it was just astounding. Some of the programs are owned by hospitals, some by community agencies, some by insurers, some by employers. When what I've seen, it's a fragmented, redundant system that typically floats single disease programs out there. And I just often think, boy, if you put this, thinking about the resources being put into all these programs, boy, what I could do with that in my primary care practice. I'd love to see all that money put into primary care, and I think on the same amount of same dollar, I could expand into a comprehensive disease or health management program. So I think what makes sense is first that primary care should own care management. I think the education for primary care doctors puts us in great position to do that. Our attitudes typically are conducive to that. Most people want to be doing that with their lives. So I think and part of the task will be as primary care doctors to rise to the task of doing it. As I said, the attitude is nurtured in training already. I think patients expect to have a degree of management from their doctors as they engage in a primary care relationship. And it can't, but what we lack is a tradition of systematization. Part of the training doesn't include methodology to do a comprehensive job at care management. Yet I think this is at the heart of patient centered care and value based care for that matter. And I think it needs to be holistic. We can't, it does make sense to start and get our practice on the few high cost, high risk diseases out there, like diabetes, heart failure, stroke, breast and colon cancer. But ultimately, all patients, all diseases, all conditions, all preventative health should be managed in all patients. So again, I give you permission to implement a single disease management program, but as you do that, I'd suggest that you ask yourself, how will this process work for the five most common conditions? And how will it work for the 100 things I see only 2 or 3 times a year, but want to manage just as well as I do those common conditions? Uh, I see so many management systems jury rigged to the point that they only work for that single condition, and that the practice really gets weighed down by the weight of adding a new system on top of that system. Really, our chronic management system should really scale to the entire set of needs of our patients. Now, specialties each own their own management of a set of events, and for specialties, it's not. Comprehensive or holistic care management for patients. It's typically an episode, some kind of event, or a specific disease. So if you're an endocrinologist, yes, you should be doing some longitudinal management of diabetes. Although I think in the well-run system, we'll probably be punting that management back to the primary care doctor when their systems are working well enough to be relied upon. But for the typical specialist, it may be around a specific condition and a procedure, let's say hip pain and an ultimate hip replacement. the management runs into the transitional care management, both transitioning from primary care into the consult or the referral, in preparation for surgery, the procedure, recovery, and then transition back to primary care management. So I think everyone has that bit of management that they need to own. Now, I'm heartened by the trends in this regard. The AMA has been creating, and CMS is allowing payment for a steady stream of new billable codes representing a broad spectrum of the care management continuum, and I'm pleased to see this. The bad news is it still introduces that level of complexity and frustration for patients and providers, making sure uh, you've got the rules right for each of those care management codes. The fact that a phone call that the patient didn't ask for necessarily results in a charge sometimes tends to be a problem. And I really like the trend that's happening in parallel to that proliferation of care management codes, the movement toward capitated care and the care management. Because in those regards, we get paid to take the best care possible of patients, not by the visit or by the call, so we can roll those calls in to an excellent care program. So, I think in the near term future of primary care is to reimagine that primary care practice as a source of comprehensive or holistic care management. And I'd like to see you start thinking about your primary care practices as a healthcare help desk, and that will help you to imagine how to use your advanced systems to create a program that holds together for all patients for all conditions.